Hello, friend, and welcome to this episode of the Mental Health Coach Podcast. This week is OCD Awareness Week, and we're diving into an important conversation about obsessive compulsive disorder with a special guest, Carrie Bock. Carrie is a licensed professional counselor who specializes in helping people navigate the challenges of OCD. OCD Awareness Week is dedicated to raising awareness, reducing stigma, and providing education about OCD. People with OCD often experience significant distress and impairment in their daily functioning due to their symptoms, and around 1/3 of people with OCD do not receive the treatment that they need. Many misconceptions surround the disorder, and this week is an opportunity to provide important information about OCD while dispelling myths and encouraging those who are struggling to seek the treatment they need. Whether you're seeking a better understanding of OCD or looking for ways to support someone with it, this episode is packed with valuable insights. Let's dive in. Hi, friend. Welcome to the Mental Health Coach Podcast. Do you struggle to feel as present and joyful as you'd like to in this season of life? Are you feeling overwhelmed with juggling so much between work, worrying about your kids, and managing all the things? Hi, I'm Jen Alley. I'm a mom, a wife, and a licensed professional counselor. I know that even good lives come with challenges. Parenting struggles, loneliness, marriage problems, trauma, addiction, and financial stress, just to name a few. I have been guilty of trying to get through the hard times alone and presenting a polished exterior while struggling on the inside. In this podcast, I will share brain science, intentional practices, and real-life stories to help you better understand yourself and improve your connection with others. Think of me as your friendly mental health coach. The same way that you turn to a personal trainer for your physical health, I'm here to teach you important emotional and relational skills to help guide you through life's challenges. As a reminder, this podcast is not therapy, but it is a great adjunct to therapy. So if you're ready for some coaching and support as you navigate your life with less overwhelm and more joy, I'm ready to walk beside you. Throw on your tennies, pop in your earbuds, and let's walk and talk. Hey friend, if you've been around for a while, you know I'm passionate about helping you feel less overwhelmed and more connected to yourself and your loved ones. Just like physical fitness or achieving work and financial goals, good mental health requires intentionality, building routines, structures, and practices that support your well-being. If you're ready to feel more present and less stressed, the first step is identifying the practices that work best for you and make them a priority. That's why I created a free guide, 5 Steps to Discover and Implement Your Non-Negotiables, a busy parent's guide to feeling less overwhelmed and more present. If you're ready to go from overwhelmed to empowered, you can download your free copy today at jenalley.com, or you can click the link in the show notes wherever you're listening. Carrie, I'm so glad to have you on the podcast. And I wonder, could you just tell listeners a little bit about yourself and also how you came to specialize in OCD, and actually even a little bit about your practice and your podcast that you have, whatever feels important to share about your work?
Sure. So my name is Carrie Bock, and I am a licensed professional counselor in Tennessee. I have a practice called By the Well Counseling, where I really focus on trauma, anxiety, and OCD. I have started a podcast several years ago that I called Hope for Anxiety and OCD, that has now shifted very recently to Christian faith and OCD. So the podcast is really just some practical strategies and tools for Christians who are suffering with OCD to be able to have a greater sense of peace and calm in their life. It's really been a journey on how I got there. I worked a lot with people who are dealing with trauma and anxiety, and sort of flowing out of that. If you work with enough people with anxiety, eventually you'll start to gradually see some people who have OCD traits, and maybe they don't necessarily have full-blown OCD, but then you start to see some of those that have more of a full-blown OCD presentation. So I started dipping my toe in the water and using some of the EMDR and trauma therapy type background work to help these individuals. And more recently, I've been using inference-based cognitive behavioral therapy, or ICBT, to help clients with OCD. So it's been a progression and a journey to get to this point, but I really enjoy what I'm doing.
Yeah, I love that. So I have so many questions kind of to follow up with that, but I wonder first for the layperson, could you differentiate like what is
Sure.
OCD or how does that different from just general anxiety? Because people kind of talk about it flippantly, like, oh, I'm so OCD, but what really truly is OCD?
Yeah, I think that's a great question because most people's perception of OCD is like that show Monk, if people have seen
Mm,
that, where he has contamination OCD and he's afraid to touch the doorknob, or he has to have like a sanitizing wipe around. And there are many different manifestations of OCD. OCD involves having obsessions, those are those sticky thoughts that you can't get rid of, can't
mhm.
seem to get out of your mind, things that you don't even want to have in there that pop in when you don't want them to. Could
Yeah.
be sometimes violent images, could be sexual thoughts or images, could be a
Mhm.
stuck thought about a relationship. What if this person breaks up with me and then my life is going to be totally over? So OCD takes these different forms or themes that it involves. Can be harm OCD, where you're concerned about harming yourself or someone
Mhm.
else. Obviously, that can be really scary because to someone who is not familiar with OCD, it could look like the person is suicidal, even though those are thoughts that they are not wanting to have.
Yeah.
And then everyone has some form of a compulsion, even if that compulsion is ruminating or just thinking and trying to understand, trying to do research, processing. Typically, people will Google a lot of different things and read articles for a long time or be on YouTube for 2 to 3 hours just watching different videos on different perspectives of the same issue. I work with a lot of people who have scrupulosity, which is a like moral or religious based OCD. So they might be concerned about things like losing their salvation or blaspheming God or did I commit the unpardonable sin? They can Google and watch all these different videos and get really stuck on looping in those pieces. You also, of course, have your typical compulsions like checking or
Mhm.
cleaning. Those also show up as well. They can take a variety of forms like reassurance seeking, where
Mm.
you're asking somebody else a question, do you think I'll get cancer and die? Or do you think I'm okay? Is our relationship all right? And the problem with the compulsions is they provide a very short term, temporary relief for the
Yeah.
person feels a little bit better for the moment, but then it just loops right back into that cycle.
Yeah.
So they have this obsession, feel the anxiety, engage in some kind of compulsion, and then they're back in that loop of obsession again.
Yeah, no, that's so helpful and true. And also then it just reinforces the loop, right? It's like reinforcing that neural network and then strengthens it. So it's like every time they complete that, even though they feel a little bit better for that moment, it's just making that feedback
Right.
loop stronger. Is that
Hmm.
how you think of it?
Yeah, absolutely.
Yeah. And then I also liked what you were saying because I think that's an interesting way of thinking about it. And correct me if I'm wrong, but it's like a lot of these disorders, like OCD, it's on a dimmer where maybe it's like you see certain tendencies towards some of this. And then, like, on the other end, it's like full blown. Is that kind of how you would describe it when you were talking about people who would come into your practice and you would just see like some of these things happening? And then other people, it's like full blown. Like, how do you kind of differentiate? Like, I'm just imagining the person listening to this and they're like, well,
Sure.
I do that. Or like, well, that sounds like me. How do you know if you truly have OCD versus just anxiety?
Right. So I can think of people. I have a good friend who's really big into organization. And I mean, her closet is beautiful. And probably if you went in there, her shirts might be color coded or
Mm,
nothing's out of place, right? Everything's
sure.
nice. The folded items are nice and neatly folded. I like to say that we joke with my husband because I tell him, you're particular, you're not OCD. Like he has a certain
Mm,
pattern and a process and a way that he likes to do things. He's very
yeah.
routine, even down to he was taught to eat his food a certain way as a child, and that
Mhm.
has just really stuck with him. And so I find it funny, and other people are like, that's really strange. You haven't like touched your meat yet. But he said, well, no, I've got to eat the vegetables first. But it does not cause him to stress. I would say that's the
Mm.
difference. My friend with the organized closet, she enjoys that. She likes being organized. She feels good about it. And she's not doing it repeatedly or compulsively. Whereas you may have somebody else that has an organized closet, but they will go back in there. And if they see that just one little piece askew, they will refold the whole pile of shirts,
Yeah.
or they will move the hangers around, or, oh, this hanger is, just off, just so I've got to move it here. Mark Summers, the guy actually that used to host Double Dare, wrote a book, and I can't remember what it is right now, but maybe you can look it up and
Sure.
throw it in the show notes for people. But he talked about combing the fringe on his rugs at home, just trying to make sure, spending hours and hours doing something. So, yes, it is a continuum where I find that there are some people who are anxious, and when they are at high levels of anxiety, they may engage in certain compulsive behaviors. I wouldn't say that those people in particular have OCD. Then there are other people where they are noticing this is taking a lot of time. I'm in my head all the time. People are trying to talk to me, but I can't focus because I'm just getting these obsessions over and over, or I'm spending hours on compulsions. Now it's really impacting your life, right?
Yeah.
So, whenever we look at any kind of mental health disorder, as well, that we're looking at how does that affect that person's ability to function in their day to day life.
That's right. So I love that. So it's sort of like if it's causing you stress and it's uncomfortable, or if it's really infringing upon your life, taking up a lot of your time, then that's when we would consider like this is a problem. It's causing
Yeah.
problems in your day to day functioning. It's not just an enjoyable thing that you're wanting to do. And I don't know if this feels true for you. I know I'm thinking of a couple of clients who have presented with symptoms of OCD in the past who when they were going through something stressful in their own life, something hard, a hard period of time, it did seem like their symptoms, whether it's that like need to check, like that got really amped up in their life. Is that consistent with what you see with clients with OCD?
Yeah, absolutely. Stress is the number one thing that makes it worse. And so sometimes we have to start at a baseline of coming up with an overall stress management plan. How are you managing your day-to-day stresses at work, at home, in the family? Do you exercise? Are you getting enough sleep? All of those healthy
Sure.
habits that anybody wants to have
Yeah.
good physical and mental health, I think are even more so important for someone dealing with OCD, because the stress really will ratchet up those symptoms.
Yeah. So, first up is kind of like a stress management plan. We're going to identify what it is that you do to manage your stress. So let's imagine you have someone come into your office and they're like, yeah, I'm like doing all of those things. Then what? And you talked about a specific therapy that you do. I'm curious about that. I don't know anything about that particular modality, but maybe you could just tell us a little bit about it. So somebody comes in, okay, step one is make sure that their stress management plan is in place. And then like what's next? What does treatment look like for you as you work with clients?
Right. I try to be really trauma informed in my
Mm.
practice, and I've seen that trauma and OCD will often feed off of each other. One thing that many people don't realize is that 25% of people who qualify for an OCD diagnosis also qualify for a PTSD diagnosis. And
Yeah.
that's one quarter of the people coming in. That's a pretty significant chunk. We can't
Yeah.
ignore that. So, really assessing what was this person's childhood like growing up, or have they had some significant trauma in their adulthood,
Yeah.
grief and loss that may have gotten mixed up in all of this, and have to be able to tease that out. If there is trauma that is contributing to the obsessive compulsive cycle, I'll just give a random example. This doesn't have to do with anybody that I've worked with, but for example, if someone, say, had a family member who died of MRSA or major staph infection in a hospital, and now they're avoiding all doctors, hospitals, routine medical work that they need to have done,
Yeah.
then we're probably going to attack that trauma piece first
That's
before we
right.
go after the OCD specifically.
Mm.
If it's a situation where they know they do have some trauma in the past that maybe they've done some work around, or
Mm.
they don't feel like that's the main thing that's triggering them right now, I feel like, no, it's the OCD piece, then we may work on the OCD piece first. And then as the trauma emerges, we can work on that as it emerges. But I really love inference based cognitive behavioral therapy, or ICBT, because traditional OCD therapy is called exposure and response prevention,
Yeah.
ERP, and it does work well for some people. For other people, it's really hard for them to engage in, and it has a pretty high dropout rate. What ICBT does, instead of focusing on just riding out the anxiety, not engaging in the compulsion, we go back and look at the obsession and determine, how do we know that this obsession is even valid or not?
Mm.
What's happening in the here and now? It's very mindfulness based,
Mm.
just focusing on what's actually going on in the present versus what your brain tells you is going on in your present moment.
Yeah.
So, any type of really good OCD therapy is about retraining your threat detection system, because OCD is telling you that there's this big bad threat. It's creating a lot of anxiety, physical symptoms in your body saying, hey, there's danger, when there's actually not danger.
Yeah.
So, we have to retrain your brain to recognize, like, oh, this is what OCD is telling me, but this isn't really what's happening in the here and now sensory experience.
Yeah. Yeah, I love that. I mean, I think I don't do that particular type of therapy, but it feels very similar to some of the work that I do, like coherence therapy. So it's like this idea that all of our symptoms somehow make sense and like uncovering that. But then, as you say, doing experiential work to help our brains understand and be in the moment with what is danger, what is safe. And because a lot of clients are walking around like their body feels like it's in danger all of the time, right? Or it gets
Right.
tripped
Yeah.
into feeling like it's in danger. And we know that anxiety is sort of like higher up on the food chain. So it's going to take priority over other things and hijack a client's ability to just like be like, it's fine. I'm fine, because your body doesn't feel like it's fine. It feels like it's in danger. So my understanding is that we know that trauma and life experiences can probably have an impact on the onset of having OCD. We don't have a specific reason like why OCD happens. Like there's not a specific cause that we know of, although research would suggest that some people's brains and genetics are more wired for anxiety or more wired for OCD. I don't know if you have any thoughts about that. I'm always curious about like, what part is environmental. And then of course we know that our environment and our situations impact our brain and vice versa. So I don't know if you have any thoughts about like what you see come into your office.
Yeah, so from what I've read on the genetic end, it looks like you have a 10 to 17% chance of being likely to develop OCD if you have a parent or a sibling with
Yeah.
OCD. So we know there is some genetic component, but not a huge genetic
Mm-hmm.
component. One thing that I see in a lot of my clients in terms of early childhood experiences is that many of them grew up in very rigid family systems.
Yeah.
So, for example, there was a right way to make the bed and there was a wrong way to make the bed. And if you made the bed the wrong way, you were either shamed or, told you were stupid, or there was definitely this heightened sense of anxiety. That may have been because your parent grew up in the military and they wanted the bed made a certain way. It could be
Yeah.
because your parent was OCD and they had a cleanliness theme going on where to manage their own anxiety, they needed that bed made a certain way. It also can filtrate into thinking, though, and this is where people get really tripped up in dealing with religious themes. If the church told me this, but now as an adult, I'm not sure that I believe that anymore. But
Yeah.
OCD is telling me that I need to be really focused on this, and it's using this past experience to feed into the present obsession.
Yeah.
So I see a lot of rigidity, sometimes dependency or enmeshment as
Mm-hmm.
well. Like, you can't think differently because we need you close. We need you to be a part of this family. And if you think differently or branch out on your own, then we lose that sense of control. There's not safety of being able to be yourself in that environment. If you are raised by a family member that has untreated OCD, that can be very anxiety provoking as well,
Yeah.
obviously, because you're sensing your parent is very anxious and you're seeing them maybe engage in some of these ritualistic behaviors that can be easy to copy and follow through with. So there is that nature and nurture component. One thing I was going to say earlier too is that the person with OCD is not always the most distressed. It may be other members of the family
Yeah.
because the person with OCD is being very demanding about, oh, well, you came home from this place over here, you're contaminated, now you need to take a shower. And they can place a
Right.
lot of rules and rituals and expectations on other people in the family to manage their own anxiety. And they may really believe, well, depending on their level of insight, they may really believe, well, this is just what needs to be done. I mean, this is what needs to happen, or we can't go into that restaurant. That restaurant is dirty.
Yeah. No, that totally makes sense. And I think that like your description of it too can maybe help the listener have compassion for themselves if they find themselves having, symptoms of OCD, because it's likely that based on your, historical experiences, maybe you were raised in a really rigid environment. Because when you were talking about it, it's almost like there's not just this need to do something in order to avoid, whether it's like, punishment or whether it's shame, but it's also this sense of belonging, right? In order to be like a part of this family, I have to like behave in this very like specific way. And so it
Yeah.
makes so much sense. So yeah, I'm just having like a lot of compassion, right, for people who come in with this, because it's really painful to experience that and to have that sort of need for control and rigidity in order to feel like, I'm okay, I'm safe, other people around me are safe, right? So I don't know what that kind of brings up for you, but that's what it's bringing up for me as you talk through it.
Well, sometimes treatment, especially with ICBT, they focus on the feared self versus the real self. And the feared self is who OCD is trying to tell you either that you are or are going to become. So it's
Mm,
like, well, if you're not careful enough, then
mm,
somebody else is going to be sick and it's going to be all your fault.
yeah.
Versus your real self probably is careful. Your real self probably is
Mm,
very compassionate towards other people, so being able to help people connect with their authentic self, like you were talking about parts
mm,
work, like a really healthy adult part of yourself can help combat that OCD. But sometimes that requires a certain level of identity development, of being able to
absolutely.
branch out and make decisions on your own, learning to take appropriate risk. That's
Yeah.
something that can be really challenging for someone with OCD. Like, sometimes you just have to say, like, okay, well, I may get sick, but I still want to go to my child's program. Or yes, I'm going to feel super uncomfortable going into the public restroom, but I really want to take my child to the zoo, and that's important to me, and so I want to be able to work through this.
Yeah, I love that because I think, probably for all types of therapy too, a huge part of this is being able to understand what's going on and recognize it and differentiate enough from it in order to be like, oh, there's this part of me, right? Or there's this like OCD part that is going to make this very difficult or that's going to feel really scared. But having enough, I don't know what you would say, like I'd say like witnessing mind or prefrontal cortex online in order to identify that this is a part of me that feels really stirred up or feels really agitated or upset. Because I think that's probably, it's just like the first step of anything, right? Recognizing we have a problem and then having enough awareness about it. Because for a lot of people, this is just like how they are and how they live. And maybe they haven't had that separation of like, oh, this is like not me. This is something that came about, likely, because of some brain differences or just some developmental or some life experiences that I have developed this part that really is so, so fearful.
Yeah,
Yeah.
absolutely.
How about the difference between obsessive compulsive personality disorder and an obsessive compulsive disorder, since they're two different things? Like, how do you see that in your practice, or do you differentiate between those two things?
Yeah, I don't work with people with OCPD, obsessive compulsive personality disorder, I think I would refer those cases out. But that is, I think, more of a global
Mm.
rigidity. Usually, in people who are dealing with OCD, they have other aspects where they're not as rigid and more flexible and more able to take different perspectives. Where I think
Mm.
that person with, I'm sure I probably have seen someone like that in the
Sure.
past. It's much more, I would say it's much more difficult to treat whenever you start talking about personality disorders
Yeah.
versus, an OCD diagnosis.
Yeah. And maybe, and I mean, I think probably part of that is that people with OCPD, I think it's actually more common, but people maybe don't seek treatment because they don't see that there's an issue. Like it
A
doesn't
problem.
feel like there's a problem, like there's something problematic about it because it's more of like a way of being. Yeah. So
Yeah.
that makes sense. Are there any myths or misconceptions about OCD that you feel like as a therapist who treats that population that you wish to kind of clear up, or any misconceptions that you think like people think this about OCD, that's not really true, or that's not what you see?
Yeah, I would say definitely that all OCD people are organized, or that they all are super schedule really well, or that their closets look really nice, or that they're super clean people. That's not necessarily the case. That the gamut can run, just like we talked about, a wide variety of themes, and
Yeah.
that you could know someone in your life for quite some time and never realize that they struggle with OCD because they're very functional. They're able to
Mm-hmm.
participate in their job, they're able to participate socially, but internally, they're dealing with a lot of torment. And because of that, it feels very isolating because we have this public perception that, oh, you just have some disorder where you like to organize things, or you enjoy things a certain way. It can feel very isolating for them to not have that sense of, like, everybody kind of knows what anxiety is nowadays. I mean, thankfully, it didn't used to be where we could talk about these things
For
openly,
sure.
but people are much more open to talk about anxiety or depression. But if you were to tell someone in your community center or in your the PTA that, hey, I'm having obsessions about harming children, or I'm
Mhm.
afraid that I'm a pedophile, they're probably going to look at you really sideways and hope that you never come back.
For sure.
We're going to ban you from watching children,
Yeah.
when in reality those types of themes hit people based on what's values are important to them. So if someone is scared to be a pedophile, it's typically because they care about children, or they have children, want to have children. Those
Mhm.
types of scenarios, people that are afraid of harming someone else may actually be very compassionate and considerate of other people's feelings. So these things are very incongruent
Mhm.
with who the individual with OCD actually is. So I guess that was what I would want other people to know who maybe don't know as much about OCD, is
Yeah.
that it can be very isolating, scary,
Mhm.
lonely, and misunderstood. I think this is a very misunderstood population.
I'm so glad you're naming that, because I'm even thinking for the person who maybe does have thoughts like that, that they would be scared to even reach out for help because it feels scary to name those things, right? Or to say those things out loud. Especially when they themselves, like, they don't want to be having those thoughts or those feelings come up. And so I'm wondering about that. Like, with somebody who is seeking help, like, is there a point at which you recommend medication for your own clients? Like, I know you probably, I'm sure you kind of go through, as we said, kind of setting up first, like, okay, what's your stress, kind of stress response? Like, how do we take care of the stress management in your life, and then therapy? But is there a point at which you find medication to be helpful in treating OCD?
Definitely. And this is something that I have changed my own stance on over time. I used to have a very lackadaisical stance about medication, specifically for things like anxiety and depression. Now, if I saw someone that had a severe level of symptoms, I would say, hey, maybe you might want to try medication. But it's your personal choice. If you want to, you can. If not, you can try some therapy first. You can try lifestyle management. Now I do an OCD assessment with clients when they come in, if they're telling me, they have OCD, or if based on some of their symptoms of what they're telling me in the intake, I will send them the OCD assessment. And looking at that score, a lot of times I'll make a recommendation to them to seek out medication if they haven't already. Some people obviously come in and they're already on medication. They may need to get it reevaluated, or they may say it's helping some, but not helping as much as I need it to. But what I've seen with OCD, especially in the more severe cases, they need the combination of medication and therapy to have the best results. And people, struggle with that, with the stigma of being on medication, or do I really need to do that? And so that's usually what I'll tell them is I will say, it looks like your symptoms are impacting you in a big way based on your assessment and just talking to you, what we've talked about looks like it's impacting you. And I just want you to know that the research on OCD shows that those that have the best outcomes have it with a combination of medication and therapy. And that usually helps people kind of get to that decision.
Yeah. No, I think that that's really good. And I also feel the same that like that's exactly what I've seen in my own practice. And also, I think that there's something to be said for like if you've tried various things and your stress plan is in place and you're doing all the things and it's not helping, like you're not feeling good still. It's the same as if you had diabetes and a doctor would prescribe insulin, right? It's the same
Yeah.
thing that like your body needs support that like, yes, with diabetes, we could first say like, try to eat healthier and try to do these things. But if you're either A, doing those things and it's not helping enough, or B, like you can't do those things because whatever is creating the struggle, in this case OCD, is like prohibiting you, like maybe because of the cleanliness thing and you feel like you can't leave the house to exercise or something, you might need that support in order to even be able to do the things that would help raise your baseline and help you to be more stable.
One thing that I tell people about medication is that it is the booster seat to the table of coping. So
Yes.
sometimes we just need that little extra boost that helps
Yeah.
us get up to be able to utilize the coping skills.
Yeah.
It's not a crutch. It's not something that we necessarily have to depend on for our whole life. You can make that evaluation depending on how therapy goes. You can always
Mhm.
later on look at lowering your dose of medication under your
Yeah.
doctor's guidance if they feel comfortable with that and you feel comfortable with that. Some people just say, hey, I feel really good and I don't have a ton of side effects. I'm going to stay on the medication and make sure that I'm in a good place. So for each
Mm.
person, that's individualized. But those are usually things that people are concerned about. Oh, I don't want to be dependent on the medication, or I don't want to have to be on it my whole life, things
Yeah.
like that.
No, that's so good. And so you mentioned this a little bit before, but as you said, like sometimes family members are going to be the ones who are most impacted. But I wonder for the family members who might be listening to this podcast, if somebody's like, oh, yes, I live with someone or I know someone who has, pretty severe OCD, what advice do you have for them? What do you advice would you give to family members or friends of somebody who has OCD?
Yeah, I think it depends on is that person in treatment or not, is probably going to be how you would approach it. But it's important for family members and friends to know that the reassurance doesn't help. A lot of times
Yeah.
people will seek reassurance from those closest to you. And if you're a leader in a church and someone's asking you about the same scripture over and over again, it's not going to help them to keep re explaining it.
Mm.
Or if you're in a relationship, it's not going to help. Your boyfriend's not going to be benefiting you if he's just
Mm.
constantly giving you reassurance about the relationship and how
Yeah.
he feels about you. So that's, I think, the biggest thing for friends and family members to know is to watch out for that reassurance seeking and really kind of get to a place where you can talk about it
Mm.
in a comfortable way. Sometimes people will name their OCD different
Mhm.
things. So,
Totally.
okay, well, it sounds like, and then we have a language to talk about it that's
Mhm.
in a compassionate and respectful way instead of saying, oh, your OCD is really interfering right now, or making some type of accusation statement like that. You can say, It seems like Mr. Clean is really preventing you from being able to go out to eat tonight.
Yeah.
Would it be okay if we dined in? Or do you think that we can work through this so that we can go to our favorite restaurant?
Yeah.
What do you think about that? And I think asking that person, what do you need? How can I support you in this
Mhm.
process? I think is huge for anybody that's dealing with this. They may just need you to listen sometimes
For
about
sure.
how frustrated they are to be stuck in this cycle at
Yeah.
times.
For sure. And, I would also recommend like that family, if you live with someone with OCD, you might need support yourself because it could be really hard, to live with somebody who has OCD too. So maybe
That's true.
seeking your own mental health and support. You're like a wealth of information on this. So where can our listeners find you if they're interested in you and interested in learning more about you and your work?
So my website is carriebock.com.
Okay.
That's Bach like the chicken, not the composer.
Okay.
And my podcast is called Christian Faith and OCD, and you can get that wherever you get your podcast.
Perfect. And I'll make sure and link all of that in the show notes. I really appreciate you taking the time to meet with me today and to talk through this really kind of complicated diagnosis. I really appreciate your time and your expertise and your wisdom.
Well, thank you for having me.
Hey, friend, I hope you enjoyed today's show. If so, would you take 30 seconds and leave a written review for the show on Apple Podcasts? Also, please share the show or your favorite episode with a friend so we can grow our community of like minded parents wanting to feel more present and less overwhelmed in this crazy thing called life with a family. I'll meet you back here next Wednesday with another episode of The Mental Health Coach. Thanks so much for listening.